Hi guys, and welcome back to EverlastCyber. We'll be going through the part 6 video of the NACC PSW 2025 practice questions and answers. Let's start right off with question 1. While helping Mrs. Lee, who recently had a stroke, dress for breakfast, she struggles to button her shirt but insists on doing it herself. You notice she is getting frustrated. What should you do? A. Tell her you will finish it quickly so she can eat on time. B. Let her struggle until she asks for help. C. Encourage her, offer minimal assistance, and praise her efforts. D. Take over immediately to prevent her from becoming upset. Now, in this situation, after a stroke, promoting independence is a key part of recovery and rehabilitation. But before we answer the question, let's go through the options. In option A, this would be incorrect because taking over the task may save some time. However, it discourages independence and it will make her feel incapable. Option B is also not ideal since letting her struggle too long can increase frustration and anxiety and thereby hinder progress. Mrs. Lee's efforts to button her shirt shows that she wants to regain control over her daily activities. That is, activities of daily living. That's ADL. So, encouraging her, offering minimal assistance, and praising her efforts is the best choice. Option D is also incorrect because immediately taking over removes her opportunity to practice and regain function. So, in nursing care or in home support worker care, especially for stroke patients, always balance assistance with independence. That is providing support without taking control. So, out of the options we have here, based on the scenario, the best choice would be option C, encouraging her and offering minimal assistance while praising her efforts. Question 2. A disorder characterized by the recurrent violation of the personal or property rights of others and of societal norms is known as A. Personality disorder, B. Dementia, C. Pseudodementia, D. Conduct dementia. Personality disorders refers to enduring patterns of behavior and inner experience that deviate from cultural expectations. Now, this does not necessarily involve recurrent rights violation as seen in what it's supposed to be. In option B, dementia involves cognitive decline, such as memory loss and impaired reasoning, but it is not an exhibition of antisocial or rule breaking behavior. Pseudodementia describes depression that mimics dementia symptoms, not behavioral misconduct. Conduct disorder is a behavioral and emotional disorder that is commonly diagnosed in children and adolescents. It is characterized by a repetitive and persistent pattern of behavior in which the basic rights of others or major societal rules and norms are violated. So, based on these explanations, the best answer is option D. Examples of conduct disorder includes aggression towards people or animals, destruction of property, deceitfulness or theft, or also some serious violation of rules like truancy or running away either from home or from school. So these are examples of conduct disorder that is characterized by the recurrent violation of the personal or property rights of others and of societal norms. Question 3. You find Mr. Gomez on the floor near his bed. He says he slipped while trying to reach his walker. What should you do first? A. Help him stand up right away. B. Ask if he feels pain and check for injuries before moving him. C. Leave him to call another PSW. D. Report it after completing your shift. Now, in option A, this would be incorrect because helping him up right away could worsen an injury, especially if there's a fracture or head trauma. So, when a client is found on the floor, your first priority is safety and assessment, not to move them immediately. The correct sequence of action you should take is number one, stay with the client and remain calm. Then assess for pain, consciousness, and visible injuries. So you can check if he hits his head, if he's bleeding, or if he shows sign of fracture. Do not move the client until you are sure that it is safe, because moving someone with a possible injury could cause further harm. Next, you can call for assistance if needed. So you can either call a nurse or you can call your supervisor. Then you report and document the incident according to facility policy. Option C would be incorrect. Never leave the client unattended after a fall. And option D is also incorrect. The incident must be reported immediately and not after your shift. So the answer here is option B. Question 4. Mr. Rakim has an ankle brace. You notice a reddened area on the ankle bone when you remove the brace. You should A. Put a bandage on the reddened area. B. Massage the reddened area. C. Report your observation to the nurse. D. Do all of the above. In option A, putting a bandage on the area is not appropriate unless you have been specifically instructed by a nurse, because you may trap moisture or even worsen the irritation. Option B is also incorrect. Massaging the reddened area is not the best thing to do because it can cause tissue damage if the skin is already under pressure. A reddened area on the skin under a brace is a sign of pressure, and this could indicate the beginning of a pressure injury, also known as a bed sore. This needs to be reported immediately to the nurse for assessment and for further instructions. In option D, doing all of the above would be wrong because already options A and B are unsafe. So our answer here is option C. Report the observation to the nurse. So whenever you observe redness, swelling, or skin breakdown, especially under a brace or a splint, do not treat it yourself. Report your observation to the nurse. Question 5. At the end of your shift, you realize you forgot to record that you assisted the client with toileting. What should you do? A. Record it as done earlier, even if unsure. B. Ask another PSW to write it for you. C. Write an accurate late entry, noting the time and date. D. Leave it unrecorded since it's minor. Accurate and honest documentation is a legal and professional responsibility in nursing and personal support work. So even if you forget to record the care, you have to make a late entry. Now, never falsify or omit information. So the best thing to do is to make an accurate late entry, noting the time and the date. So for instance, you can clearly indicate in your entry the actual time and date that the care was provided. Indicate also the time and date that you are making the entry and include a note explaining that it is a late entry. These little details actually helps towards the client's care plan. Question 6. You are about to clean a client's bedpan and you notice you have a small cut on your hand. What should you do before continuing? A. Wash your hands only. B. Cover the cut with a waterproof dressing and wear gloves. C. Ignore it if the cut is small. D. Ask someone else to clean for you. Option A is incorrect because hand washing alone does not prevent microorganisms from entering through an open cut. In option B, infection control and personal safety are top priorities in healthcare. So even a small cut can be an entry point for pathogens. So it must be properly covered before performing any task involving body fluids, such as cleaning a bedpan. So in option B, applying a waterproof dressing protects both you and the client from infection. Wearing disposable gloves also adds another essential barrier. In option C, this is unsafe. Ignoring a cut increases the risk of cross-contamination and infection. Option D is unnecessary because you can safely perform the task as long as you cover and protect the cut properly. So our answer here is option B. Question 7. A family member asks you about another resident's health condition because they are friends. What should you do? A. Share general information to be polite. B. Tell them to ask the nurse in charge. C. Politely explain you cannot share that information. D. Ignore the question and walk away. Client confidentiality is a fundamental principle in healthcare. So, in option A, sharing general or partial information violates privacy rules. Option B is partially correct, but it is better to directly refuse politely rather than redirect to another staff member, unless the family insists on speaking with someone. You cannot disclose personal health information about a resident to anyone not directly involved in their care, even if that person is asking as a friend or a family member. Option D is unprofessional because ignoring the question may seem rude or dismissive. So we'll be going here with option C. Always protect resident confidentiality. If a family member persists, you may inform a nurse or supervisor, but never disclose private information yourself. Question 8. You're caring for Mrs. Brown, who is in the final stage of cancer. She appears restless and keeps moving around in bed. What should you do first? A. Restrain her gently so she doesn't fall. B. Notify the nurse and provide comfort measures like repositioning. C. Leave her alone to avoid disturbing her. D. Increase the room temperature. Restlessness in a client in the final stage of cancer can indicate pain, anxiety, discomfort, or other physical issues. So, option A, restraining her would be incorrect because this can increase distress and risk of injury. This should only be used as a last resort, but under strict medical orders. The first step is to assess and respond appropriately while keeping the client safe. So, notifying the nurse ensures professional assessment and intervention, and then providing comfort measures such as repositioning, offering pillows, or gentle touch can alleviate anxiety and discomfort. In option C, leaving her alone is incorrect because she may need immediate comfort and assistance. And in option D, increasing the room temperature is not a first line intervention and it may not even address the cause of the restlessness. So, what you should do first from these options is option B, notify the nurse and provide comfort measures like repositioning. Question 9. Mr. Singh, who has dementia, accuses you of stealing his wallet. What is your best response? A. Argue and tell him you would never steal. B. Laugh it off and ignore him. C. Stay calm, acknowledge his feelings, and reassure him you will help look for it. D. Report him for false accusation. Now, The first thing you need to know is that clients with dementia may misinterpret situations or become suspicious. They might even accuse caregivers of theft. That is why when a client offers you a gift as a support worker, you're meant to politely decline it. And even if they, start to show distress, insisting that you should take it, you should report it immediately to your supervisor. Now let's look at the options. Option A is incorrect because arguing can increase agitation and distress. Option B is also incorrect because laughing or ignoring him may make the client feel dismissed or disrespected. So the goal is to remain calm, avoid confrontation, and provide reassurance. Acknowledge the client's feelings without arguing. Reassure them that you will help to look for it, and this can reduce their anxiety and agitation. And then maintain a trusting and safe environment. In option D, reporting for false accusation is inappropriate because their behavior is due to dementia and not intentional wrongdoing. When caring for clients with dementia, validation, calm reassurance, and redirecting attention are effective strategies for managing confusion and agitation. So our answer here is option C. Question 10. You overhear another staff member shouting at a resident and calling them stupid. What should you do? A. Ignore it. It's not your business. B. Confront the staff member angrily. C. Comfort the residents but don't report it. D. Report it immediately to your supervisor or nurse. Option B is incorrect because ignoring abuse is unprofessional and unsafe. Option B is also incorrect because confronting that staff member may escalate the situation and compromise safety. Option C is also incorrect. Resident support alone is insufficient. That abuse must be reported. Verbal abuse of residents is unacceptable and must be addressed immediately. So your priority is the safety and well-being of the client and ensuring a professional, respectful care environment. Reporting the incident protects the residents and also allows appropriate action to be taken so supervisors or nurses can investigate and ensure staff accountability. So our answer here is option D. Report it immediately to your supervisor or nurse. Question 11. You're assisting the client with bathing and notice they have a rash that was not there before. What should you do? A. Report your observation to the nurse immediately. B. Apply lotion from another client's supply. C. Ignore it since the client didn't complain. D. Take a picture for your records. A new rash on a client's body can indicate an allergic reaction, infection, or skin irritation. So prompt reporting will ensure that the client receives timely assessment and treatment. The nurse can assess the rash and determine the appropriate intervention. And also, early reporting can prevent complications and also promotes client safety. Option B, using another client's lotion is unsafe because it can spread infection or even trigger allergic reactions. In option C, new skin changes should never be ignored, even if the client is not complaining. And in option D, taking a picture violates the client's privacy policy. Taking a picture is inappropriate because it violates privacy policies unless it is explicitly authorized by the facility. So our answer here is option A, report the observation to the nurse immediately. Question 12. Mr. Ahmed refuses to take his morning bath and shouts at you to leave. What is your best response? A. Insist that he must bathe to stay clean. B. Leave the room, give him time and try again later. C. Report him to his family for refusing. D. Tell another PSW to handle him instead. Clients have the right to refuse care, and respecting their autonomy and personal choices is essential. Forcing care upon a client can lead to resistance, distress, or conflict. So, based on this option, we'll be going with option B. Respect the client's choice while keeping them safe. Allow time for the client to calm down. This would increase the chance of their cooperation later. So, you can reapproach gently or even offer alternatives like a sponge bath instead. Question 13. You're helping a client in the dining room when you smell smoke coming from the kitchen. What should you do first? A. Run to check the kitchen. B. Shout for help and panic. C. Wait for the supervisor to arrive. D. Move the client to safety and activate the fire alarm. Now, in any fire or smoke situation, the first priority is client safety. Protecting people from harm comes before investigating or responding to the fire source. So, it's quite clear. The best choice will be option D. This ensures that the client is safe by moving them away from danger and then activating the fire alarm to alert others and initiate the facility's emergency response plan. This is the first thing you should do. Ensure that the client is safe and then activate the fire alarm. Question 14. Mr. Chan becomes very anxious before bathing, saying he is afraid of falling. What is the best approach? A. Tell him not to worry because you hold him. B. Force him to bathe quickly to overcome the fear. C. Reassure him. Explain each step calmly and ensure safety during the bath. D. Leave him alone until he's ready. In option A, simply telling him not to worry may invalidate his feelings. Option B is unsafe because it can increase fear, resistance, and risk of injury. Option C is correct because it acknowledges the client's fear without dismissing it. Explaining each step will give the client a sense of control, and then you can implement safety measures like using non-slip mats, using grab bars, and supervising them to prevent falls. So, clients who are anxious about bathing may fear falling or losing control. The best approach is to provide reassurance, clear instructions, and then ensure safety. This will help to reduce their anxiety and promote their cooperation. Option D, leaving him alone may delay hygiene needs and it doesn't address the anxiety. So the best option is, or rather, the best approach is option C, reassure him, explain each step calmly, and ensure safety during the bath. Question 15. During meal service, a client refuses pork, explaining it's against her religion. What is your best action? A. Insist she eats a small portion for nutrition. B. Offer an alternative meal according to her preference. C. Remove the plate and give no meal. D. Tell her religion shouldn't affect her diet. In option A, insisting is inappropriate because forcing food violates the personal rights of the client and can cause distress. Clients have the choice to make dietary choices. Clients have the right to make dietary choices based on religion, culture, or personal preference. Providing appropriate alternatives respects their autonomy and beliefs while ensuring proper nutrition. So, this would be the best action, but let's check out the other options. In option C, removing the plate is neglectful and it denies nutrition. This is also disrespectful and shouldn't be done. Option D, telling her religion shouldn't affect her diet is disrespectful and unprofessional, so this should never be done. The best choice or the best action is option B. Offer an alternative meal according to her preference. So this would honor the client's religious and cultural practices It will also ensure that she receives a nutritious meal, and it demonstrates respectful, client-centered care. Question 16. A client begins to cry while you are helping her dress. She says she misses her family. What should you do? A. Change the subject to distract her. B. Tell her to stop crying and focus on dressing. C. Listen empathetically and offer comfort. D. Leave the room to give her privacy without saying anything. Option A is dismissive because it does not validate the client's feelings. Option B is insensitive and disrespectful. You must never tell a client that. Clients may experience emotional distress due to loneliness, illness, or separation from their loved ones. So, providing emotional support is an important part of holistic care. Showing empathy and understanding, providing emotional comfort will help the client feel heard and supported. This would also maintain a therapeutic relationship between you and the client. Option D ignores the client's emotional needs, and this should never be done. The best action is option C. Listen empathetically and offer comforts. Always acknowledge and validate their emotions because listening and offering comfort fosters trust, dignity, and the emotional well being of the clients in their care. Question 17. A client tells you that another staff member shouted at her last night. What should you do? A. Keep it to yourself to avoid trouble. B. Ask the staff member about it privately. C. Report it immediately to your supervisor or nurse. D. Tell the residents not to worry about it. Any allegation of staff abuse or mistreatment must be taken seriously. So it's actually a no-brainer here. The best choice here is to report it immediately to your supervisor or nurse, and that is option C. Reporting ensures the client's or the resident's safety, and it will allow the facility to investigate and address the situation. This protects the residents from potential harm. It also follows legal and ethical responsibilities for the reporting of abuse, and it will ensure proper documentation and investigation by management. So this is the best thing to do. Question 18. You notice a client's medication cup is still full 30 minutes after you placed it by the bedside. What should you do? A. Dispose of the pills quietly. B. Encourage the client to take them and inform the nurse. C. Hide the medication so it's not found. D. Leave it there until the next shift. Option A is unsafe and it is considered as medication mismanagement. This should never be done. Medication safety is a critical responsibility. So, if the client hasn't taken their medication, what you should do is to encourage compliance while respecting the client's choice. Also, inform the nurse who can assess the reasons for refusal or delay, and then they'll be able to take appropriate action. Option C is unprofessional and also violates medication protocols. And option D is not the best choice because it risks missed or double doses and it compromises safety. So the best choice here is option B. Encourage the client to take the medication and also inform the nurse. Question 19. What is the name of the dementia type characterized by brain deposits known as plaques and tangles that disrupts critical processes and ultimately compromises living cells? A. Frontotemporal degeneration dementia. A. Frontotemporal degeneration dementia. B. Vascular dementia. C. Pseudodementia. D. Alzheimer's disease. Frontotemporal degeneration dementia primarily affects behavior, personality, and language, but it doesn't necessarily affect the memory alone. Vascular dementia is caused by reduced blood flow to the brain, and this usually happens often after strokes. In option C, pseudodementia is memory and cognitive symptoms that is caused by depression. It is not actual brain cell degeneration. Alzheimer's disease is the most common form of dementia, and it is characterized by amyloid plaques. This is protein deposits that accumulate between neurons, and also neurofibrillary tangles. This is twisted fibers of tau protein inside neurons. These plaques and tangles disrupts communication between brain cells, and this can eventually lead to cell death, causing memory loss, cognitive decline, and impaired daily functioning. So out of these options, our answer is option D. Alzheimer's disease is the type of dementia characterized by brain deposits known as plaques and tangles that disrupts critical processes and ultimately compromises living cells. Question 20. After a resident passes away, their daughter begins crying uncontrollably in the hallway. What should you do? A. Tell her to calm down because other residents are watching. B. Offer quiet support, listen, and allow her to express her emotions. C. Avoid her by giving her privacy. D. Tell her to talk to the nurse instead. Family members may experience intense grief immediately after a loved one passes away. Providing emotional support is an important aspect of holistic care, and it helps them to process their feelings. So, in option A, telling her to calm down is insensitive and dismissive. In option B, offering quiet support shows empathy and compassion. It also provides a safe space for expressing emotions, and it helps the family member to feel supported and heard. Option C neglects the emotional needs of the family, and option D may delay support. You can comfort the family member immediately while involving the nurse if needed. So here, the best action is option B. In grief situations, active listening, empathy, and presence are more important than rushing or directing the person elsewhere. So offer support while maintaining a calm environment. Question 21. A client with partial dentures is unable to remove them herself. What is the correct way to assist? A. Pull them out quickly before brushing. B. Ask for permission, remove them gently, and clean both dentures and mouth. C. Ask another PSW to do it instead. D. Soak them overnight without cleaning. Proper oral care for clients with dentures involves gentle handling, hygiene, and respect for autonomy. So option A, pulling them out quickly, is unsafe because this can cause injury or discomfort. Option B would be correct because you ensure you've obtained consent by asking for permission. Then you remove the dentures carefully to prevent damage or discomfort. And lastly, clean the dentures and the client's mouth because this will help to maintain oral hygiene and prevent infections. In option C, asking another PSW to do it is unnecessary unless you cannot perform the task safely. In option D, soaking without cleaning is incorrect because dirt and bacteria can accumulate, causing oral infections and irritation. So our best choice of answer is option B. Ask for permission, remove them gently, and clean both the dentures and the client's mouth. Question 22. While bathing a dying client, you notice family members are watching and taking photos. What should you do? A. Ask the family to step out until care is complete to protect the client's privacy. B. Ignore them and continue. C. Stop bathing immediately and call security. D. Allow them to take photos as it's their loved one. Now, even at the end of life, clients have the right to privacy and dignity. Bathing is a personal and intimate task, and family members taking photos can violate the client's privacy. So, option A would be correct because this protects the client's dignity and confidentiality. It also ensures that care is provided professionally and safely, and asking the family to step out should be done politely and respectfully, explaining the reason to the family. In option B, ignoring them is inappropriate because it allows privacy violations to occur. Option C is unnecessary, that's calling security. It is unnecessary unless the family refuses to comply, then you can call security. Option D is incorrect because even loved ones cannot override the client's right to privacy. So the best action here is option A. Ask the family to step out until care is complete in order to protect the client's privacy, even when they're at the end of life. Question 23. You're asked to transfer a heavy client from the bed to a wheelchair, but the lift equipment is unavailable. What is the safest action? A. Attempt the transfer by yourself carefully. B. Ask another PSW for help or wait until proper equipment is available. C. Ask the client to assist by standing on their own. D. Refuse to do it and leave the client. Transferring a heavy client without proper equipment or assistance can result in injury both to the client and the caregiver. Now, let's look at the option. Option A, attempting this alone is unsafe because it increases the risk of injury both to you, the support worker, and the client. Option B would be the best option. Asking another PSW for help would be the best option because it will ensure safe transfer with adequate assistance or equipment. It will also prevent falls, injuries, or strains, and it follows the facility policy on safe client handling. Option C is inappropriate because the client may fall or get injured. And option D is unprofessional. You should seek help rather than abandoning the client. So the safest action here is option B. Ask another PSW for help or wait until proper equipment is available to move the client from the bed to the wheelchair. Question 24. You notice Mr. Kelly, who usually talks a lot, is unusually quiet and has not eaten breakfast. What should you do? A. Ignore it because he might be tired. B. Encourage him to talk more. C. Observe and report the behavior change to the nurse. D. Tell his family without informing the nurse. A sudden change in behavior or appetite can indicate physical illness, emotional distress, or cognitive changes, especially in older adults or those with chronic conditions. Ignoring them in option A is unsafe because that sudden change may signal a serious problem. Encouraging them to talk is helpful, but it does not replace reporting, which is option C. Document and communicate the change to the nurse. This would enable the nurse to assess for underlying causes such as pain, depression, illness, or medication side effects. And by doing this, you support the client's safety and their well being. In option D, telling a family telling a family member without informing the nurse bypasses proper clinical channels and it may delay their care. So the best action to take is option C. Observe and report the behavior change to the nurse. Question 25. Mrs. O'Neill, who has dementia, keeps asking when dinner will be served. Even though you've told her several times it's an hour away, what should you do? A. Ignore her repeated questions. B. Respond gently each time or use distraction to ease her anxiety. C. Scold her for not remembering. D. Leave her until mealtime. Clients with dementia often repeatedly ask questions due to memory loss or anxiety. So, ignoring them in option A would be inappropriate because it can increase their anxiety and frustration. The best approach is patience, reassurance, and redirection. So, providing gentle, consistent responses will help to reduce their distress. You can also use distraction or engagement to help the client cope with waiting. So, it could be a conversation or an activity. This will help to maintain a calm and supportive environment. Option C is harmful because it can cause emotional distress and damage trust. And option D does not address her anxiety or need for reassurance. So the best approach is option B. Respond gently each time or use distraction to ease her anxiety. This brings us to the end of the part 6 video for the NACC PSW practice questions and answers. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when our next informative video will be dropping. Thank you for watching, and I'll see you in the next one.